Welcome to the 2016 Medicare Educational Seminar. To view online, go to www.turning65seminar.com. Medicare has not reviewed or approved of this presentation. Presented by Beta Benefits Insurance Services. Seminar Agenda. Understanding Medicare, Parts A and B. Medicare Health Plan Options. Understanding Part D. Medicare Star Rating. Member Enrollment Periods. Resources. Medicare and Social Security, Part B Premium. Medicare, health coverage available at age 65. Social Security, retirement, available at age 62 with reduced benefits. Here's how it all breaks down. Option number 1. If you start Medicare and you do not start Social Security, then you pay Social Security directly for your Part B premium. Option number 2. If you start Medicare and you start Social Security, then your Part B premium is deducted from your Social Security check. Option number 3. If you do not start Medicare and you start Social Security, you do not pay your Part B premium. Medicare Introduction. Medicare is a federal health insurance program developed for the aged and disabled. To qualify, you must be a U.S. citizen or have a resident visa in the U.S. for 5 consecutive years, be age 65 or over, get disability benefits for 24 consecutive months, have kidney failure or end-stage renal disease, be approved for Social Security disability with the diagnosis of ALS, Lou Gehrig's disease. Medicare is administered by Centers for Medicare and Medicaid Services, CMS. CMS is an agency of the United States Department of Health and Human Services. Parts of Medicare. Part A equals hospital, inpatient services, and skilled nursing. Part B equals medical, doctor, lab, outpatient services, and supplies. Part C equals Medicare Advantage plans. Part D equals prescription drug coverage. Original Medicare exclusions and limitations. No medical coverage outside of the U.S. No coverage for routine vision, dental, hearing, and podiatry. No coverage for acupuncture, hearing aids, or dentures. No custodial care or nursing home care. Deductibles. Coinsurance. Gaps in coverage create financial risk. A standalone prescription drug plan can be a separate expense. Here's a look at a sample Medicare card. You must have Parts A and B to qualify for any Medicare Advantage plan. Part A eligibility. Part A. Those 65 or older, or their spouse, who paid Medicare payroll taxes for 40 working quarters. And under age 65 if disabled for 24 consecutive months. Purchasing Part A, monthly premium. In 2016, it's $411 for those with fewer than 40 Medicare quarters. Part A subsidized for qualified Medicare beneficiary, QMB. Part A benefits. Inpatient. Hospital coverage for 90 days per benefit period, plus 60 lifetime reserve days of hospital coverage past day 90. Inpatient psychiatric care, up to 190 lifetime days. Skilled nursing facility, up to 100 days per benefit period, only after 3 days of hospitalization. Home health care, hospice care. Part A service costs. In 2016, it's $1,288 for your Part A deductible per benefit period. Then, hospital days 1 through 60 are a $0 coinsurance. Hospital days 61 through 90 are $322 per day. Hospital days 91 through 150 are $644 per day. For skilled nursing facility care, days 1 through 20 have a $0 coinsurance. Days 21 through 100 are $161 per day. Part B eligibility. Part B. At age 65, those who elect Part B premium to be deducted from their Social Security check quarterly, and under 65 if disabled for 24 consecutive months. Getting Part B later. Those who do not elect Part B when first eligible, but have employer group health coverage, can enroll in Part B when they retire without penalty. Others who refuse Part B when first eligible may elect Part B only in the general enrollment period and will pay a penalty. Part B will then be effective July 1st, following the general enrollment period. Part B penalty. Unless you have health insurance from your employer or spouse's employer, for each 12-month period you delay enrollment in Medicare Part B, you will have to pay a 10% Part B premium penalty. Others who refuse Part B when first eligible may elect Part B only in general enrollment period and pay the 10% Part B penalty. Part B will then be effective July 1st, following the general enrollment period. Part B benefits. Physician services, outpatient hospital services, clinical labs, ambulance, diagnostic tests, X-rays, MRIs, CT scans, medical equipment, eyeglasses after cataract surgery. Part B cost of services. In 2016, $166 annual deductible plus 20% of the Medicare approved amount for services and items. Part B income-based premiums, based on the previous year 2015 reported adjusted gross income, and varies depending on if you're single or married. See where you qualify in the different brackets, and then see what your total monthly premium would be. Part C, Medicare Advantage plans. Joining a Medicare Advantage health plan. Part C eligibility. Must be enrolled and entitled to benefits under Part A. Must be enrolled in Part B. Must reside in health plan service area. Part C plan health coverage. Must be equivalent to or better than Medicare Parts A and B. May include extra benefits not covered by Medicare Parts A and B. May include Part D, prescription drug coverage. Types of Medicare Advantage plans. HMO, Health Maintenance Organization. PPO, Medicare Preferred Provider Organization Plan. Note, a PPO plan is not a Medicare Supplement plan. PFFS, Medicare Private Fee-for-Service Plan. SMP, Medicare Special Needs Plan. MSA, Medicare Medical Savings Account Plan. Medicare Supplement Plans. Take a look at the different plan options: A, B, C, D, F, G, K, L, M, and N. They each offer different plan coverage options. Benefits comparison. Medicare Supplement versus Medicare Advantage with prescription drug coverage. Medicare Supplement plans offer no prescription drug coverage. Limited guarantee issue options based on health history. Offer direct access to specialists. Monthly premiums are based on age, plan selection, and county. Premiums increase over time. Copays are based on plan selection. For prescription coverage, you must purchase a standalone prescription drug plan. Offer no or limited value-added services. Must purchase dental and vision plans separately. Must purchase a plan with foreign travel coverage. Medicare Advantage with prescription drug coverage. Offer prescription drug coverage. Guaranteed issue except for those with end-stage renal disease. You must pick a primary care provider and stay within that network. No or low premiums that vary by county. No or low copays apply. Copays for drugs vary by plan and gap coverage. Often value-added benefits at no or low premiums. Wellness, fitness, dental, vision, emergency coverage for foreign travel. Part D Prescription Drug Benefit. Prescription drug coverage. Established by the Medicare Modernization Act of 2003. Must be entitled to Part A and/or enrolled in Part B. Medicare does not administer Part D benefits. Part D can be offered by a Medicare Advantage plan or by a private standalone Part D plan provider. Except for dual eligible, Medi-Cal and Medicare, beneficiaries must actively select a Part D plan. For 2016, the late enrollment penalty is 1% of $34.10, the national average premium, times the number of months without credible drug coverage. Part D enrollment. Part D coverage is voluntary only for non-dual eligible members. There's a penalty of 1% of the national standard premium for every month the beneficiary could have had Part D but chose not to enroll. Part D open enrollment is October 15th to December 7th. You may not enroll in two Medicare-certified Part D plans at the same time. Dual-eligible beneficiaries, Medi-Medis, must have Part D coverage. Part D model coverage. All Part D plans must minimally be actuarially equivalent. Monthly premiums vary by Part D drug plan. Annual deductible cannot be more than $360. Initial coverage limit, ICL, for drugs is $3,310. Enrollee true out-of-pocket troop cost threshold in the gap or donut hole is $4,850. In the gap, enrollee pays 65% of the cost of generic drugs and 42% of the cost of brand name drugs. Enrollee cost share above the threshold, which is catastrophic coverage, $2.65 for generic or preferred multi-source drugs, $7.40 for all other drugs, or 5% of the drug cost, whichever is greater. Part D income-based premiums, based on your 2014 yearly income, and varies depending on if you are single or married. Check to see which bracket you are in. Then, check your premium rate. This premium is in addition to the plan premium. Understanding Part D. Medication Therapy Management. A voluntary program where a pharmacist or other health professional will give you a comprehensive review of all your medications. Formulary. A listing of Medicare-approved drugs. Health plans generally cover drugs listed in their formulary, as long as it's medically necessary and the prescription is filled at a network pharmacy. Step therapy. In some cases, health plans require a member to first try a more cost-effective alternate drug before covering another drug for that condition. Prior authorization. In some cases, health plans require the member or physician to get approval from the health plan before the prescription can be filled. Medicare 5-Star Rating System. Measures the overall performance of Part C Medicare health plans and Part D prescription drug plans. Aids consumers in the selection process. Star ratings from 1 to 5 stars. Medicare members have a yearly, one-time special needs enrollment, whereby they can switch from their current plan to a 5-star plan. 1 star equals poor. 2 stars is below average. 3 stars is average. 4 stars is above average. 5 stars is excellent. Member enrollment periods. Part D Initial Election Period, IEP. 2016 Annual Election Period, AEP. 2016 Annual Disenrollment Period, Special Enrollment Period, SEP. Initial Coverage Election Period, ICEP. Member enrollment periods. Initial coverage election period, ICEP, begins 3 months before the beneficiary's first entitlement to both Medicare Part A and Part B. Can end on the last day before eligibility month. Ends as late as 3 months after the month of eligibility. Part B can be pended beyond the initial month of eligibility if the beneficiary has creditable coverage through an employer group or union. Part D Initial Election Period, IEP, for those who are newly eligible for Medicare Part D prescription drug coverage. Initial election period of Part D occurs simultaneously with ICEP when beneficiary is newly eligible to Medicare. Only one Part D enrollment choice can be made. Those eligible for Medicare prior to age 65 will have another IEP when attaining age 65. Member enrollment periods. Open enrollment period, OEP. Available to all MA and Part D eligible beneficiaries. Begins October 15th and ends December 7th. Beneficiaries can stay with their current plan, add or drop MA and/or drug coverage, or return to original Medicare. Generally, effective date of coverage will be January 1st. Annual disenrollment period, January 1st to February 14th, where Part C beneficiaries can disenroll from MAPD plans and return to original Medicare, and may enroll in a PDP plan during that same period. Dates are not official. Member enrollment periods. Special enrollment period, SEP, available to those experiencing unique qualifying events. You will have one opportunity to change your Medicare Advantage plan or Part D plan. Examples are, people dually eligible for Medicare and Medi-Cal can enroll year-round. People with low income subsidy can enroll year-round. If you change your residence and move outside of the plan's prior service area. If there is a change or loss in your employer or union group health coverage, or if there's an involuntary loss of creditable drug coverage. Resources. Medicare information for consumers, www.medicare.gov, or call 1-800-MEDICARE. For Social Security related questions, call 1-800-772-1213. TTY users should call 1-800-325-0778. For Medi-Cal related questions, go to www.medi-cal.ca.gov or call 1-800-541-5555.